Hi, Dr. Scott Jensen here. March 17th, 2022, 2-year anniversary of our first lockdown in Minnesota on March 17th, 2020. Lots changed since then. I think frankly, Minnesota, America, and the world were on the ropes. This is a time for brutal and honest discussion. What happened with that lockdown that was supposed to take place for 15 days in March of 2020? Well, we've seen kids left behind. We've seen children literally forced to bear the brunt of numerous public policies designed not to protect the kids, to protect the vulnerable in ways that ultimately proved to not be effective, to protect power and control of certain stakeholders, politicians, and bureaucrats. But we've seen the kids left behind. We've seen the psyche of Americans damaged collectively and individually. We've seen certain groups of Americans think about suicide and commit suicide like never before. We have seen nursing home patients locked in their rooms, desperate, and then desperately dying alone. Their families locked out. So much of the disease that caused Minnesota to be nation leading in nursing home deaths was born of policies that didn't need to happen. In Minnesota, Tim Walz could have learned from what had happened in New York that you can't take patients from the hospital and put them back into the nursing home without checking to make certain that they're not infectious. We bought a $7 million building to store bodies that never saw a cadaver. I think since then it's been sold for a loss and it's got a leaky roof. When that happened, I got on the phone and I called hospital administrators and I called morticians and I said, are you concerned that the COVID death rate is so great that you're not going to be able to store the cadavers, that we've got a problem? There was no concern. We saw goalposts established and then moved. We heard flatten the curve so we don't overwhelm healthcare facilities. We saw policies govern these lockdowns that weren't science-based. In Minnesota, the first lockdown, you couldn't get a haircut because that was not essential and it was not safe. But the second lockdown, you could get a haircut. Where was the science? In the middle of these policies, we had the governor writing executive orders to tell the pharmacy board, to tell pharmacists to not dispense the medicines physicians were prescribing for their patients. And then, when the governor decided to remove that, he did so quietly, almost like a thief in the night, so that it wouldn't hit the radar of news media coverage. We had an epidemic of fear. We saw the expansion of government by way of emergency powers like never before. We saw modeling done without demonstrating to the public what the assumptions were. We saw debates on masks, and I was vilified because I made comments about the physics of the features of masks in terms of the pore size, in terms of the size of a COVID-19 particle. I made comments that were right in line with what Mike Osterholm, Dr. Mike Osterholm, epidemiologist in Minnesota, what he had said, what Tony Fauci had said, Dr. Fauci. But when my comments were made, they were worth vilifying me for. We had mandates that we were told wouldn't happen, and then they happened. Transparency was kicked right out the window. The American public was screaming for honesty. We were getting fighting between the World Health Organization and the FDA and the CDC. Just recently, we had the director of the CDC, Walensky, saying that Pfizer never told her that their vaccine might not be as effective against variants. Duh, really? You think we haven't seen mutational aspects and variants created from previous respiratory viruses like influenza virtually every year? It's been a rocky course, and we're 2 years out. And now we're sort of told that we can celebrate because we've beat it, we've won. No, we haven't. You do not pummel an RNA respiratory virus like COVID-19 into submission. It doesn't come out at 11 o'clock at night like a mosquito, which would then justify some sort of curfew at 11 o'clock, which what Governor Walz did. That makes no sense, and it's not scientific. That's not what this virus does. This virus moves and mutates. It spreads and it kills. And frequently, the majority of the time, you will see it be a relatively influenza-like illness. Have we seen clear corruption of the way we do death certificates? Without question. Virtually everybody on both sides of the aisle acknowledge that there have been problems. Dr. Fauci came out and said that if a young person goes into a children's hospital with a broken leg and because of policy is identified as having an asymptomatic positive PCR test, that is not a COVID admission. That's a broken leg admission. To some of you media types who don't understand that, please get a brain. Think about this. You scream and you demonize and you call people names. Why don't you reach out and call me and tell me exactly what I said that you think constitutes misinformation? And let's have the conversation. In the meantime, in Minnesota, we've had dramatic waste, fraud, and abuse. We've had hundreds of millions of dollars lost, wasted, criminally stolen in the daycare industry. We've had a program that's supposed to feed the hungry. $100 million of fraud. And so that program, it went away. And yet, when America says we're concerned about the integrity of how we do things, when Americans say, can we make sure that as we go forward, we have honest and fair elections? People are called conspiracy theorists. And yet, both sides of the aisle have screamed about this. Democrats have screamed in 2000 with the hanging chads in 2004. They were concerned about harvesting ballots and vouching, and the Republicans are concerned. We have hundreds of millions of dollars wasted on daycare fraud and feeding the hungry fraud, but we don't have $1 million or two to do a forensic audit, which would be nothing more than simply applying scientific methodology to an event that occurred in order to reconstruct what happened and see if there was wrongdoing. We're not talking about an internal compliance audit for a bank. We're talking about something that's critical to the American people. And yet, when they bring this up, they're called conspiracy theorists. We've got an inflation like we haven't seen in a long, long time. Just today, Governor Walz does a video telling Americans, telling Minnesotans, that he's going to give us $500 a piece if we make less than $165,000 to help cover the increased gas costs. So he's not interested in giving you a vacation from the gas tax anymore. Now he's going to give you $500. You know what that is? That's a little Band-Aid. This is a bigger Band-Aid, Tim Walz. This would be a big Band-Aid. But maybe what we need to do when it comes to this inflation and gas prices more than doubling, maybe we need to think about, how did this happen? How did the supply chains become so interrupted? How did our work ethic become so undercut? It's because Tim Walz was willing to take every dollar that came Minnesota's way, even if it destroyed our work ethic, even if it put people on the sidelines that we needed in the workforce to make Minnesota strong. It's called the scalpel. Maybe we better excise the cancer. Our work ethic is dashed. Minnesotans, We don't need more politicians. We need you back on the field. We need every one of you who can work. We need you back in the workplace. And you shouldn't have been fired because you were following your core convictions. That was wrong. Why does government make so many of our choices for us? Why can't we trust Minnesotans? We're dealing with a respiratory virus in a similar manner that we've dealt with before. This one clearly was bigger, huger, killed more people, hospitalized more people. But still, the science that we knew, we didn't apply. But what we did do was we subjected real science, the process of observing and measuring and hypothesizing and creating experiments, we subjected that to pander to political science. That's what we did. And so we said to the physician and the patient, you don't get to decide together what you're going to do to take care of this. Patients, shut up, sit down, and get in line. The government's here to rescue you. And oh, by the way, if you're going to die in the ICU, you'll probably be alone, and you'll probably look like Darth Vader in one of the movies in terms of what you see come in that door, because that's what your caregivers will be looking like, and your family won't be there. This is what we've done. We cannot forget this. Folks, we have abused you. We have told you, you don't count. You don't get to make your own choices. The government's going to make them. Tim Walz, Coleman, Newsom. This is what's happened over the last 2 years. And through it all, what's really happened is the trust has been broken. The trust has been broken. And now how do you create it again? A couple of months ago, in our clinic, we had a patient come in. They had gotten COVID vaccination, but it hadn't gotten on the registry in Minnesota. They asked my staff to go ahead and put it in. My staff wasn't sure what to do. We reached out to the Department of Health. We said, well, we're not administering COVID vaccines, but the pharmacy downstairs is. And the patient had been a reliable patient and said that they got the shot on such and such a day and never got a phone call back from the Department of Health, but we reached out to them and they said this: for historical vaccinations that you have not administered, we ask that you ask the patient for the trade name. If the patient knows the trade name, then we go ahead and put the information on the registry. That doesn't make sense to me. How is that reliable? How is that the way we should? We don't give the vaccine, but we can record it. And all the patient has to do is say, on February 5th, I got a vaccine, and it was a Pfizer, and we record it, but if they don't say Pfizer, then we're told, don't record it. That's the Department of Health. I'm not trying to cause a ruckus here. I'm just asking a question in the same way I did at the very beginning, when I said that death certificates should not have COVID-19 as the cause of death if the patient was dying of stage 4 colon cancer and was on hospice for 3 or 4 weeks and was scheduled to die in a day or two, depending upon how their last hours went. And yet I was demonized, I was vilified. This is the size of the report I had to submit a month ago to the American Board of Family Medicine, because I am now being investigated by the American Board of Family Medicine because I denigrated vaccines. I denigrated vaccines. All right. I spend $250,000 a year spending money for vaccines for my patients. I think our clinic administered 1,000 flu vaccines this year. My children are vaccinated to what my wife and I consider full vaccinated status. I have received tetanus and diphtheria shots and many other shots and hepatitis B shots throughout my career. What's this patient's chart? Oh, younger than me. COVID, Pfizer, twice, plus a booster. 95% of my patients over the age of 70 have been vaccinated. Did you hear me? Greater than 95% of my patients over the age of 70 with underlying medical conditions have been vaccinated. Does that sound like a damn anti-vaxxer to you? And yet I'm vilified. I'm demonized. I hope you sleep like a baby at night, some of you folks. I'm not calling you names, but you have sure been liberal about calling anybody a name that you want to. You have been a big part of why the trust is broken. And I want to talk about a colleague of mine in the Senate. I normally don't do this, but he has been so mean-spirited, I think it's worthy of a discussion. Dr. Matt Klein. We campaigned together in 2016. We were elected at the same time. You and I coming into the Senate was the first time a physician had served as a senator in 25 years. We got together for dinner. We tried to see what we could do to help healthcare in Minnesota. When Governor Dayton collapsed, and I ran down the aisle to participate in helping revive him, you sent me a text in the days to come, thanking me for coming down and taking the lead on that resuscitation effort. You criticized me with sharp words, saying that I was beyond irresponsible right at the beginning of the pandemic in early April or late March of 2020, because I had signed on to a commentary saying, couldn't we be a bit more judicious as to how we decided what was essential and what was not, what was safe, what was not. I never called you a name back, but you said I was beyond irresponsible. A couple months later, I gave my resignation speech in the Senate. You were one of the first people to hustle down the aisle and come to me and give me a hug. And then, since then, you have said I've been unethical. Today, in a newspaper, you said I've been unethical. Never once did you call me. Never once did you say, Scott, can we sit down and talk about this? You just vilified me. Matt, I had people ask me, why didn't I retaliate? Why didn't I have a bunch of people submit anonymous complaints to the Minnesota Board of Medical Practice against you? I said, I wouldn't do that. I wouldn't do that. Matt, I think you're a good doctor. I think you're a solid senator. And I look forward to the day where you and I can have civil conversations again. And I will not call you names. I want to talk about Matt Burke. Matt Burke is my running mate. He's my partner. He's running to be lieutenant governor. I chose him because he has character, because his skill set will help fill in some of the gaps I might have, and because he's determined to help Minnesota. It didn't take more than a few days for people to rip on Matt Burke, call him names, demonize him for something he said 10 years ago. Do we not all grow? Do we not all experience new things? And doesn't that change us? Doesn't that change the shape of our views? Shame on you people for being so casually willing to call people names. This 2 years of the COVID pandemic has done more than just cause unnecessary lockdowns, compromise our children's spirit, increase suicide in many groups. This has done far more than plunder our confidence in government, and politicians, and bureaucrats. This has put us on a path to hell. We have a divide in this country that may not heal for decades. I think we all need to step back, press pause, and say, how can we be a part of building bridges and having conversations? And let me tell you a little bit about my own personal journey over the last 2 years. I have gone from being a respected faculty member at the University of Minnesota Medical School and Family Doctor of the Year, and a wonderful medical practice that I've worked for 40 years. All those things have been turned upside down because of COVID. I never told a lie about COVID-19. It's possible that when I said something that I thought to be true at a given point in time turned out to be not true. I will grant you that, and I will apologize for those moments. Just point them out to me. I have not tried ever to spread misinformation. But the fact of the matter is, this COVID-19 journey has pushed my wife and I to realize that our political system is broken, that our public health bureaucrats are broken, that the CDC and the FDA are broken, and that we need help. I don't have all the answers, But I know that after 2 years, there are so many things wrong. And when Governor Walz comes to Minnesota and say, hey, gonna give you $500, that'll be better than taking away the gas tax. My stars, isn't that exactly what we have been seeing over the last 2 years? Band-aids instead of solutions. And when the media and Dr. Matt Klein decide that they get to decide what is unethical and what is ethical, isn't that just the problem? I think it's time for all of us to step back on St. Patrick's Day today and say, what can I do going forward to do something better? Because I'll tell you, our political system is broken. And the one place that we can look for help going forward is the everyday Minnesotan, the everyday American. That is where the common sense lies. And for the media, and for the big tech, and for the big pharma, and for the big government, whose agendas have intersected so conveniently, shame on you. Call me all the names you want. Do whatever you need to do. But you'll never, never get me on your side. Minnesotans, we're on the ropes. We're so much better than this. Time to reflect. Thank you.